Hello, my name is Patrick Joynt. I'm a pediatric emergency medicine fellow at Children's Hospital, Colorado. Along with the collaborators you see, we examined the relationship between state trauma designation and pediatric readiness score. Colorado has a robust state trauma designation system in addition to the ACS National Trauma Designation System. In addition, it was one of 2 states chosen to pilot the updated 2020 National Pediatric Readiness Project assessment. Prior studies demonstrated an association between higher weighted pediatric readiness scores and pediatric outcomes. Facility trauma designation was not associated with improved pediatric outcomes. With the new data, we wanted to reevaluate whether or not trauma designation is associated with increased pediatric readiness score. This was a cross-sectional study of the 2020 NPRP pilot assessment. We compared hospitals with and without state trauma designations with regard to their 2020 weighted pediatric readiness scores and several factors related to pediatric care, including weight in kilograms, pre-calculated pediatric drug dosing, child maltreatment assessment, radiation dosing protocols, policy for pediatric deaths, pediatric pain assessment, interfacility transfer agreements, and disaster plans that included pediatric considerations. Analysis was a one-way ANOVA test with p less than 0.05 decided as statistically significant. There was an 83% response rate, which in the end was 69 facilities meeting inclusion criteria. In an unadjusted analysis, increasing level of trauma designation was positively associated with higher pediatric readiness scores, with a median weighted pediatric readiness score for level 1, 2, 3, 4, and non-designated centers of 71.9, 74.1, 62.9, 54.0, and 65.7 respectively. This was statistically significant. Higher levels of trauma designation was also associated with increasing presence of selected factors, which I just described. Only 42% of all hospitals in Colorado that responded to the pilot assessment stated that they had a disaster plan, among which the majority reported including pediatric considerations. In our analysis, state trauma designation is possibly associated with the 2020 weighted pediatric readiness score and certain consensus-based pediatric readiness factors in the emergency care of children. Improving pediatric readiness remains a challenge for all emergency departments, and this study demonstrates wide variation in the presence of selected factors for pediatric care across trauma level designation. The highest levels of state trauma designation, levels 1 and 2, may serve as examples of pediatric readiness for referring facilities and their communities. These findings may have implications for statewide pediatric readiness programs who may be eligible to leverage their state trauma designation programs to support pediatric readiness across the state. Thank you.